Good morning and welcome to Groundwork Ohio's monthly webinar series, Building Momentum. Today we are focusing on health outcomes related to asthma among children 0 to 5, specifically among Black children. We have a really great panel lined up today, and we're going to kick it off here in the next 5 minutes. For those who aren't familiar with Groundwork, we are a statewide 501c3 organization focused on improving public policy outcomes that impact the lives of children 0 to 5, as well as moms and babies. We are really excited to be laser focused today on asthma and how it impacts young children and families. We have experts from the public health space, from the environmental space, clinicians, and community health workers. So we're really thrilled to welcome our panelists today. A little bit of housekeeping. We are recording this session and it will be posted on our website and emailed out to our listserv after the event. I also wanted to note that we will be taking Q&A throughout the event, so please feel free to use the Q&A chat function during the event. We do have 5 really great panelists, presentations lined up, 6 panelists, so we're going to move through those rather quickly and want you to be able to respond in real time to each content area, so there will not be a formal Q&A at the end, but rather just keep it going throughout. I'm Brittany Bolton. I'm the Vice President of Groundwork Ohio. And I also wanted to note that we are having an event September 26th in person here in Columbus. It's called our Building Momentum Institute, and it will be in Dublin, Ohio here, just outside of Columbus. Our registration link will be put in the chat here by my team. But we're really excited to help folks build their advocacy as we look and their skills in that space as we look ahead to the budget, state budget, coming up in calendar year 2025. So we'll be bringing together communications experts, lobbyists, and all sorts of folks who are constantly working in that space who can help you grow your skill set and your organization's skill set as you look toward moving public policies that impact the lives of young children and families and educators and all those who impact the lives of young kids. Make sure I haven't missed anything else. We're recording Q&A. I think it's only 11:03, but this content is so robust that I would love to pass it off to our first panelist if they're ready. I would love to welcome my friend Sharonda Whitner, who is currently serving as a Specialty Services Supervisor at the Ohio Department of Health's Bureau of Child and Family Health. Sharonda has over 14 years of public health experience and has demonstrated exceptional leadership and dedication in her role. She supervises several critical programs, including the statewide asthma program, the hearing and vision program, the Save Our Sight program, and the Ohio Hearing Aid Assistance program. And I've had the pleasure of working with Sharonda as Ohio Department of Health has contracted with us to do some family listening sessions around the state. So I've really enjoyed getting to work with you and getting to know you. Should I go ahead and read Sandra's bio too? Will she be hopping on at the top? Fantastic. Sharonda will be joined by Sandra Wabasi, who is an epidemiologist at Ohio Department of Health, and she's specifically in the Bureau of Child and Family Health. Sandra has over 4 years of experience in epidemiology, including a little bit over a year with Ohio Department of Health, and Sandra specializes in asthma, chronic disease, and infectious diseases. As a general epidemiologist within our data and surveillance section at ODH, Sandra's dedicated to expanding her expertise and skills in data and analysis. So we're really thrilled to welcome them both. I'm going to go ahead and hop off camera so you can share your presentation whenever you're ready, Sharonda, and let me know if there's any issues with the screen share. Thank you, ladies.
Absolutely. Thanks so much. So thanks so much for having us, Groundworks, for inviting the Ohio Department of Health to speak today. As someone who is aware of the impacts of asthma on Ohioans, and even myself having been diagnosed with asthma, I understand the significance and the importance of today's events. All right, so let's get started. So we're going to cover a lot of topics really quickly here. We're going to go over the data, the Healthy People 2030 goals. We'll quickly go over the dashboard, just how we're strengthening the asthma program, how our minority community engagement project is going, how people are sharing their story with us, and then we'll give you some resources that providers can use throughout Ohio, as well as resources for the community as well. So I'm going to quickly go to my colleague, Sandra, and let you go through those slides there.
Thank you, Sharonda. Hello, everyone. So these next few slides are really going to examine data on the burden of asthma among Black children and families in Ohio. So this first slide presents the current prevalence of asthma stratified by race and ethnicity for both adults ages 18 years and older and children ages 17 and younger. In 2022, approximately 16.2% of Black non-Hispanic adults in Ohio reported having asthma, compared to 10.5% of white non-Hispanic adults. For children, the disparity is even more pronounced, with asthma prevalence among Black non-Hispanic children exceeding that of white non-Hispanic children by more than double. Next slide. So next, we're going to look into asthma prevalence among children across different age groups. So in 2022, asthma was most common in children ages 15 to 17 years, with a prevalence of 13.5%, whereas children under the age of 5 had the lowest asthma prevalence, reported at 2%. Next slide. Okay, so the last data slide, we will analyze the rates of combined asthma-related emergency department visits and hospitalizations by age group for both populations. So Black children ages 0 to 5 experience an asthma ED and hospitalization rate over 4 times of the rate experienced by their white counterparts. When considering the prevalence data, this may indicate a significant underlying disparity in asthma control, as the substantial gap between asthma prevalence and rates of emergency visits and hospitalizations may reflect broader issues such as disparities in access to care and quality of care, socioeconomic conditions, and environmental factors. And I will pass it over to Sharonda for the remaining slides.
Thanks so much for that foundational information. We truly appreciate it. So this slide, we're just going over the Healthy People 2030 and what that means. So it sets data-driven national objectives to improve health and well-being over the next decade. So the goal is to reduce states' asthma attacks, asthma deaths, emergency departments visits for children 5 and with asthma, as well as reduce emergency department visits for adults who have COPD, in addition to emergency department for children 5 years and over with asthma. Through removing these barriers to the social determinants of health, we really are able to improve people's lives where they are born, grow, work, live, and age. The social determinants have a major impact on people's health, their well-being, and quality of life. Some examples to give you about social determinants of health is just the safe housing and transportation in neighborhoods, education, access to jobs and income, access to healthy nutritional foods, right? Polluted air and water, you can imagine, as well as language and literacy skills. The social determinants contribute to a wide health disparities and inequities that exist within states. So again, just you can imagine that if someone isn't able to afford food, then they're probably not worried about purchasing inhalers. So certainly some things that we need to consider, and that's why our work is so critical in this space. So this next slide, we're going to go over, to support the Healthy People 2030 goals, we're excited to release the Ohio Asthma Data Dashboard. It's a comprehensive and actionable picture regarding asthma in Ohio. This interactive dashboard displays state and county level data on topics such as emergency department visits and hospitalizations, asthma-related deaths, asthma rates for youth and adults. The dashboard can be used by state agencies, researchers, and community members, even philanthropic agencies, to better support their communities' asthma rates. Again, it's a comprehensive and actionable picture for how we can do that. Right. And then let's go to the next slide. So the dashboard can be used by all, and it's very crucial to how people better understand asthma. Okay. So this one, we're just going to go over, we talk about, in addition to like the Healthy People and all of those social determinants, the Ohio Department of Health Asthma Program works to raise awareness and spread information regarding asthma causes, triggers, and management of asthma, hospitalization rates, and reduce the disparity for racial and low socioeconomic groups. One strategy we use is through community engagement. So our community engagement activities are, we're doing community engagement listening sessions across Ohio, and we're very excited to have partnered with Groundworks. And these next couple of slides just give you some of the questions that we talked about. So we asked the community members if they could describe how asthma has experienced their life, how access to healthcare has either given them a better chance to support their asthma, or how they don't have access to healthcare and what they need to better support their asthma. We also talk about educational services and how that would allow them to better have access to asthma management. We also talk about economic stability. Again, some inhalers are upwards of $75 a piece. So they certainly inhibit someone's ability if they don't have that economic stability. We also talk about the social and community context, right? And how their neighborhood either supports or doesn't support their asthma management. And then the last one is just talking about their built environment, right? If you have asthma and you have to walk 10 blocks to the bus stop, it does make it very difficult because breathing capacity can be limited, especially if it's a time of day in which they would have more smog or things like that outside. So although we are working with these select counties, right, we do have the targeted counties that we have are Ashtabula, Columbiana, Cuyahoga, Erie, Franklin, Hamilton, Lorain, Lucas, Mahoney, Montgomery, and Summit. So that's where the listening sessions are occurring, and we're inviting community members to come out and talk to us so we can hear their story. There is an opportunity for any county of Ohio to share their story. This is on the ODH website, where you can just leave your feedback. If you go odh.ohio.gov/asthma, then you can get to the share your story. And really the share your story is a way for you to give us a recommendation about asthma, or provide your story about how asthma is going. So it really provides that. You can scan that QR code to do that. And then the last one is just for the community is this playlist that we have on YouTube. So we have our new YouTube series. It's 10 videos. They're all less than 10 minutes, but it really goes from basics of asthma all the way through breathing techniques. And again, great things. Feel free to share those. And then if you are here and you're a provider, we do have materials that you can order to give out to your patients. If you're in a community and you have, individuals, if you're in a school who might have asthma, it gives them guidance for how to manage their asthma through the CDC's exhale strategies. So again, thank you so much for inviting us today. We really are excited to support the efforts here that are happening with Groundwork Ohio.
Thank you so much, Sharonda and Sandra, for giving us that statewide context. We've really enjoyed working with you on hearing from families in their own words what their experiences are. The Q&A is open. If anyone has any questions for Sandra or Sharonda, feel free to mention them now, and I'll just put a plug. We entered in the chat that form that you have as well for families to share their stories from around the state. We threw that in the chat too in case anybody missed the QR code. So thank you so much for joining us today and giving us that context. We'll kind of laser in a little bit more to a clinical focus and talk to Dr. Lisa Ulrich from Nationwide Children's Hospital, but I think Sharonda and Sandra might be able to stick around with us a little longer in case there are questions. So thank you again, Ohio Department of Health, for sharing your time with us today. I would love to share a little bit about Dr. Ulrich before she begins her presentation. Dr. Lisa Ulrich is an epidemiologist at I am reading Sandra's, excuse me, as a pediatric pulmonologist at Nationwide Children's Hospital and assistant professor of pediatrics at the Ohio State University College of Medicine. Dr. Ulrich is director of the Pulmonary Complex Asthma Clinic and the director of Asthma Quality Improvement at Nationwide Children's Hospital. She is also the associate fellowship director of the Nationwide Children's Hospital Pediatric Pulmonary Fellowship Program, and her clinical interests include general pulmonary medicine, asthma, and pulmonary disease related to sickle cell. Thank you so much for joining us today, Dr. Ulrich. And I think before we begin, I do have one question from Sandy Jackson. Sandy, I'm not sure if I can unmute you. Let me see. I'll go ahead and unmute you right now if you've got a question, and then we'll dive into Dr. Ulrich's presentation. Hi, Sandy, can you? I think I can hear you.
Yeah, I was just asking, could someone please put the QR code back up so that I can, so that we can pull it off?
Yeah, the link that we just put in the chat is to the QR code that Sharonda shared just a little bit ago. So that link should take you straight to that form. But if there's a different one that you would like, feel free to shoot us a message. You can put it in the chat in the Q&A or email info@groundworkohio.org, and we'll make sure we get you the right link.
Thank you.
Thank you. All right. Thank you so much, Dr. Ulrich. I'll turn it over to you.
Thank you. Thank you for having me today. We have a really short time to cover a lot of information, and so this is going to be pretty condensed. If I had more time, I was hoping to walk you through a series of a lot of maps of Ohio that would help describe the health disparities for our Black children. Today, though, we're going to limit those to just a few maps. This is one that I think is important. We're not going to go over in full detail, but the different colors of the different counties represent how common asthma is in that county. The areas that are green and red particularly have high instances of asthma. You'll notice the red counties highlight our urban areas, including our major cities in Ohio. If I were to overlay a couple other maps over this area, the areas that have a higher prevalence or percent of kids with asthma, we would see that there was often a lower education level and also a lower income level with more families living below the poverty line, particularly for our Black families in Ohio. This makes a big difference because we know that asthma rates decrease as family income increases. What this means is that if your family lives below the poverty level on the left side of my graph with the blue line, you're more likely to have asthma in your family than if you had a higher income, the right side of my graph, 11% compared to 6.8%. And so income does make a difference. This is another map that I think is important. This map highlights the major roadways and highways that circle throughout Ohio. We have a lot of them. Highways impact air quality. It's well known that if you live within several hundred meters of these highways, it can impact air quality. And that is where a lot of our Black families are living. This map shows where our Black children in Ohio are attending school. The green, light blue, and light yellow are where the highest percentage of Black children attend school. Correlates pretty nicely with where we see a higher rate of asthma and higher rates of these highways. Particularly kids with asthma can be at higher risk of these air quality issues. Other air quality issues that we battle in Ohio, unfortunately, involve tobacco smoke. Every year, the American Lung Association releases a state of tobacco control. For 2024, Ohio got a grade of F, the lowest grade for 3 of the major categories, including tobacco prevention funding and ending the sale of all flavored tobacco products. This makes a huge difference on our children in Ohio. While the adult smoking rate in Ohio is just over 17%, our high school smoking rate seems low at 3.3%, but when we look at all tobacco use, including vaping, including these flavored tobacco products, it's actually higher than the adult rate. It's 20.4%. We know that vaping and all of these tobacco products negatively impact health, and so we need to do better for our children. There's a lot of social and environmental variables that can impact asthma. Outdoor exposures is a big category. Green space can be positive and help asthma. Pollution and allergen exposures can have negative impacts. Indoor exposures like tobacco smoke, cockroaches, rodents, mold, mildew, and water leaks, things a lot of our families deal with, can negatively impact asthma. At the community level, access to healthcare providers and pharmacies has a big impact. And down at the family level, we've already talked about income. Health insurance is another variable, whether you have it or don't, or whether you can afford to use it, because high deductible plans can be very expensive. Educational level matters. And then care time split amongst multiple homes. Asthma is a chronic condition that requires a good level of understanding to treat properly. This means that kids have multiple homes that need to properly understand that care. Cincinnati Children's Hospital did a nice study in the last few years that looked at kids who were admitted to the hospital because their asthma had flared. They got better and were sent home, but they got readmitted to the hospital because of their asthma. When they looked at that group, specifically patients with African ancestry were more likely to be readmitted to the hospital. When they controlled for these variety of factors, though, these social and environmental variables, if all of the groups had the same variable, there was no difference in who was likely to be admitted. This means that these community, social, and environmental factors have some of the biggest impacts on what our patients are dealing with asthma on a day-to-day basis. So we've taken a really fast bird's eye view of what's happening in Ohio, but let's walk in the shoes of a patient. This is what I get to do every day of my job. Today, we're going to meet a 5-year-old who lives in a small inner city apartment. He lives and goes to school near a highway. Mom's nervous to let him play outside because she has safety concerns, and so he spends a lot of time in this apartment. I meet him in clinic. I take a good asthma history. I learn all about his coughing and his wheezing. I prescribe him inhaled medications that are going to help, a preventative medication to keep him healthy and a rescue medication to help when his symptoms flare. I give him this really pretty asthma action plan that's a color-coded way to treat his asthma symptoms and his asthma on a day-to-day basis. And I ask the family, come back to see me in 6 weeks, because that's when I'm gonna change medications if we're not better. We can make him better. But this family doesn't come back in 6 weeks. I don't get to meet this child again for 8 months. In the meantime, he's been to the ER 3 different times for his asthma. He's not taking his preventative medications. The family had a lot of trouble getting these inhalers from the pharmacy, which is not uncommon. And now they're just confused about what's the preventative and what's the rescue inhaler. And so weren't taking either correctly. Again, a common scenario we face in clinic. So why did my pretty asthma action plan fail? There's a lot of reasons that this can fail and a lot of reasons that our therapy plans can fail for our patients with asthma. A major one is health literacy. Health literacy is not about how intelligent you are, but it's about your ability to hear, interpret, and act on health information that's provided for you. This is a different level for each patient. Medication issues are extremely common. We already heard how expensive some of these inhalers are. Even with insurance, it can be hundreds of dollars for some of our families. Whether you can access it at the pharmacy or whether you're taking it properly at the right time of day or the correct way can all be reasons that this asthma action plan can fail. When you sit down with this family, though, there's a lot more to the story, as there is to many of our families. This family has cockroaches and water damage in their home. Mom has done everything she can to take care of it, but can't afford a professional, and their landlord won't help. Mom's scared to cause too much of a fuss, though, because doesn't want the landlord to kick them out as they have nowhere else to go. Food security is a big issue for this family. Mom often goes without so that her children don't have to, and it's a major stressor. While Mom is intelligent, she has a low health literacy. She didn't understand my asthma action plan and needed more teaching on it. As a result, she didn't know who to call when her child was sick. She did the best thing that she could and that she knew how for her child, which was to take him to the emergency room so that he got the care he needed to make him feel better. There's a lot of financial concerns. Whether this child had private insurance and couldn't afford a doctor's visit or their medications because of a high deductible, or they had Medicaid and maybe couldn't jump the hurdles of filling out the proper paperwork or remembering their card to the pharmacy, common issues can happen. Transportation is another major barrier. If they had a car, maybe it didn't work. Or if you have Medicaid, it provides transportation, but this is often not reliable. Can't tell you how many times families have had to miss appointments because their transportation either didn't show or showed way too late for them to be able to attend. This mom works, and her job doesn't give her time off to care for a sick child or come to appointments, and she can't not work, and so she's really struggling to balance it all. This child splits home amongst many family members. It's hard to remember to transfer that preventative inhaler. It's hard to remember how to teach someone how to do it exactly. And they're smoking in homes he stays. It's not Mom's home, so she's not sure how to make it better. And then this family, like many of our families in Ohio, has a mistrust of the healthcare system. We know that unfortunately racism has been embedded into healthcare for far too long. They've had negative experiences that have impacted their relationship with healthcare. So how can we as providers help? I can work to provide education with appropriate health literacy level materials. We can provide resources to quit smoking. In Columbus, we're lucky. At Nationwide Children's, we can partner with schools actually to give some of these medications at school, which really helps asthma outcomes. But it's not enough. My patient needs more help. We need to be able to address housing concerns such as pest control and legal support when landlord concerns such as this family's come up. Pollution control, we talked about air quality being a problem. Improved anti-tobacco programs in Ohio. And then financial support, improved insurance access and medication coverage. The ability to access food, particularly for a child with a chronic health condition, is important. And then transportation, even to pharmacies, needs to be addressed for our families. Consistent provider education is also extremely important. A child should be able to go to any provider, including a small, very rural area in Ohio, and get the same evidence-based, guideline-based asthma care that you can get here at Nationwide Children's Hospital. We know that when that's provided, we can really improve asthma outcomes. We also need to continue to address racism in healthcare. I'm reassured to know that we've already heard some of these things being worked on today, and we'll hear even more as our session goes on. But my hope is we continue to work on these things, because if we don't, I worry that my child, my patient, will be another statistic of repeated ED visits, despite me prescribing the best medications in the world.
Thank you so much, Dr. Ulrich. And I'll pause in case there's any Q&A after that presentation. I am amazed at what you crammed into 10 minutes. I know we had to cut your slides a little bit. I'm just so grateful that you were able to keep that patient story in there, the hypothetical patient story, or that you had a better phrase for it. But really appreciate you centering the life of the child and bringing that so tangibly to life. And I think it's a great personal illustration of so many of the statistics that the Ohio Department of Health shared before you joined. So thank you very, very much for sharing that and for the work that you do with young children and kids of all ages. I'll pause in case there's any more Q&A. And if not, I think Dr. Ulrich can stick around a tiny bit longer in case there is. Thank you so much. I am going to turn us over now to talk a little bit more in depth about some of the environmental contexts that Dr. Ulrich shared, as well as that might have been touched on briefly in the ODH presentation. Jeanette Marrero is going to be joining us here momentarily. Jeanette has her BS in chemical engineering and is an environmental engineer with the U.S. Environmental Protection Agency. Thank you for joining us, Jeanette. She is with U.S. EPA Region 5. Jeanette is in the Air and Radiation Division of Toxics and Community Assistance Section specifically. In over 30 years of service, Jeanette has worked on many community projects, most recently focusing on schools, indoor air quality, radon, and asthma. So we're thrilled to have her here today. And I am going to pull up these slides. And hopefully you can see this screen. I'll put it in presentation mode. Does that look okay for you, Jeanette?
It does. Thank you.
Fantastic.
And thank you for having us, having me here today to share information on EPA's asthma program. As you mentioned, I'm in Region 5. Region 5 serves 6 states: Illinois, Indiana, Michigan, Minnesota, Ohio, Wisconsin, and 35 tribes. I work specifically on indoor air issues. Next slide. So because of that, I want to share a little bit of information about indoor air quality. When we talk about indoor quality, we want to highlight that we spend a lot of time indoors, 90% of the time indoors, and that there's many sources of pollution indoors, and many of those are 2 and 5 and sometimes 100 times more concentrated indoors. So it's a lot of things that we get exposed indoors in our environment. When we talk about maintaining healthy indoor air quality, we talk about controlling sources. So not bringing in things indoors that can cause the release of gases and particles, providing proper ventilation and filtration, temperature and humidity, because comfort is something that we will respond to, and other factors that might be perceived by the occupants of a space. Next slide. If we talk about specifically children, here you can see the different times and percentage of the times that children spend indoors. And as you can see, homes is a crucial space where children spend time. And we want to protect children where they live, learn, and play. Next slide. So indoor air quality can cause health problems. Here we're going to emphasize asthma and respiratory diseases, but you can see cancer, something like radon that could be easily tested and mitigated, can cause lung cancer. And there's other things that can cause serious problems to our health. And if we talk about children specifically, they're biologically different and they have differences in their behavior that can also increase the exposure that they have indoors. Next slide. Childhood asthma disparities is in the forefront of the asthma program. It helped us really focus on the work that we need to do. We recognize in-home environmental interventions as a critical component of comprehensive asthma care. Dr. Ulrich is a very committed doctor that talked about many aspects, and we want to have more doctors and then the medical portions of things taken care of. But we recognize also that there's environmental concerns that need to be taken care of as well. In the graph, this is a little bit older. You can see that non-Hispanic Black children has a high rate of asthma. Next slide. So when we talk about asthma control, we talk about an effective in-home environmental intervention where there is information provided by a certified, a trained person that can help the families and the asthmatic children. There's multiple components that need to be addressed, including asthma triggers and multiple triggers in asthma. Next slide. So we have to have a better understanding of some of the triggers. Here we don't have the time to go over many of these. Dr. Ulrich mentioned some of them. I want to mention nitrogen dioxide because as it relates to gas stoves, that's a concern that's out there because of with gas stoves, not only nitrogen dioxide, but also particles. So there's new information coming out on that and what could be done on that. EPA has information relating to chemicals and cleaning products, specifically a safer choice label where you can select products that are fragrance free and has other components. I want to highlight mold because that's the one thing and one complaint that we receive most of the calls related to asthma and just people in general being concerned about mold. So next slide. So this is part of an infographic series that EPA has on asthma triggers. So you can get this from our website, epa.gov/asthma. With mold, if mold is a problem, we have guidance also of how to go about preventing mold and also what things could be done to clean the mold. But three things that are important with mold is eliminating the source of moisture, drying things out between 24 to 48 hours, and keeping the moisture under control. And of course, we recognize the healthcare provider and their intervention as a key component of addressing the asthma trigger. Next slide. Besides these infographics, we have lots of information. Also, one piece of information that we have is this checklist for home visitors that has a module on mold and also on particulates. So it gives you information of what to look for in the home setting and also some recommendations of how to address them. Also, we have a specific guidance for residential mold control. It has information, again, on how to prevent and also how to clean up, including personal protective equipment. For example, we recommend people that have respiratory problems not to be around when mold is being cleaned or doing the cleaning itself. Next slide. So these indoor air triggers are not the only one, not the only asthma triggers. We have things like Dr. Ulrich mentioned that also deals with outdoor air and some other things that can cause asthma, like you see listed here, that can exacerbate asthma. So I want to take a minute to talk about outdoor air quality. Next slide. We have an infographic again, specifically on outdoor air quality. One important thing to know is that we have Air Now, which is a website that provides information on the air quality index that determines or has the levels of particles and ozone, and gives you a color-coded number so you can know what actions to take, like scheduling outdoor activities when the air quality is better, and then staying indoors when air quality and pollen, for example, is high. Next slide. Also, as part of that, as you have heard, especially last year, we had a lot of fires. So we have what you see on the right side, that is our fire map, that you can have information of the fires that are going on and how that is impacting the air quality. On the left side, you can see the air quality index and the colors that I mentioned and the different levels and actions that could be taken when we are at those different levels. Next slide. So with the wildfires, we have also a wildfire one pager with information of things that could be done. I want to highlight like having a clean room. There's videos on how to do that. Also the do-it-yourself air filter, where you can build a filter that can help you reduce the amount of particles indoors. And we have also information for schools that we work very closely with. Next slide. Not only we have information on wildfire, we have our indoor air quality emergency preparedness, response, and recovery information. And you can see here listing of the different topics as well of the type of resources and activities that we have related to asthma, like I mentioned, mold, but then also extreme heat and some of the other things when exacerbated or impacting the environment around us can also have an impact on asthmatics. Next slide. So EPA provides training, education, assessments, funding, and awards. This is information here talking about determinants of health and indoor quality, specifically on asthma for wildfires. There's a webinar coming up. We partner with different organizations, with our states, with our nonprofits. There is the Asthma Community Network that people doing asthma work can join. And they have all kinds of information on asthma, and you can have chats and discussions on different asthma topics. We have limited funding, but with that funding, we were able to provide filters in a school project. As you can see, the students building one of the do-it-yourself filters, air cleaners with the filters. We have recognition programs where we have asthma awards. Here pictured is the Wisconsin Asthma Coalition that receive our asthma award. One thing that we also have is the air sensor loan program, where people can get a sensor to be loaned to them, Airbeams and others. And I provided the one pager information, the flyer about that program. So if you're interested on getting one, you know who to contact. Next slide. One thing that is unique to Region 5 is we work very closely with the schools, and we provide free non-regulatory indoor air quality assessments. I also provided the one pager on that program. We need a point of contact in the school. We can do an assessment, focus on asthma triggers, and provide recommendations to the school district to address. Next slide. So these are examples of some of the brochures and information that we have. The yellow one on the left side is the asthma, knowing and gaining control of asthma, is focused on parents and how to address those asthma triggers. We have some activity books for kids to learn about asthma triggers. And we have this one specifically, it's called Why is Cocoa Orange, that talks about the air quality index for smaller children. Next slide. So that's my contact information and my colleague's contact information, Sheila Batka. We both work asthma in schools in Region 5, and we'll be happy to answer questions or provide training and any other support needed. Thanks so much.
Thank you so much, Jeanette. And I think we do have one question in the chat. I'll read it briefly. Do you advocate for portable indoor air cleaners to reduce ambient indoor pollution?
We have a guidance on how to go about the selection of the air cleaners. Usually what we recommend is having one that has a HEPA filter to address particles. There are many out there. You have to be careful. Some can produce ozone. Also, very important to know about air cleaners is that you need to size them correctly for the room that you're going to try to be, cleaning. And there's lots of information, like I mentioned, in the brochure that we have on air cleaners.
Thank you so much. And thank you for all of the resources you shared. I think our team is putting them in the chat as we speak. So hopefully folks are able to download those. And they said thank you as well for that answer. And really appreciate, I think we might have a few educators on as well who might be interested in some of the books that you mentioned on the last slide in particular too. So thank you so much for taking the time to join us today and for all of the work that you do. I hate to rush us, but we just have so many great speakers today. I'll keep going. Thank you so much, Jeanette. I'll be transitioning now to introduce Dr. Amy Hahn, who is a pediatric psychologist in the Department of Pediatric Psychology and Neuropsychology at Nationwide Children's Hospital. Dr. Hahn is also an assistant clinical professor at The Ohio State University and works with departments of pulmonary, allergy, and pain, providing psychology services to youth diagnosed with chronic and medical conditions to help them with adjustment and coping, adherence concerns, anxiety, and depression. For youth with asthma and their families, Dr. Hahn provides outpatient therapy services as well as inpatient support when youth are admitted for asthma exacerbations, and we're thrilled to have her here with us today. Thank you, Dr. Hahn.
Thank you so much. I'm excited to be here too, and I will be talking about asthma and pediatric mental health. And specifically, my goals today are to briefly increase your awareness and knowledge about pediatric asthma and mental health, to provide brief education about the role of psychology in asthma, and then offer some resources to those of you who are likely not psychologists and how you can support mental health concerns in youth with asthma. So as we all know, asthma affects many children in the US. And when we think about asthma management, you have to consider these complex socioeconomic aspects, environmental factors, and health disparities, as my co-presenters have mentioned. And so we want to think about what's called a biopsychosocial approach to help conceptualize how stress impacts our youth with asthma, comorbid mental health concerns, and family factors when we're thinking of treating asthma. So in general, what we know to be true is that kids who have chronic health conditions, not just asthma, but any chronic health conditions, are twice as likely to report mental health problems, including anxiety and depression, as their healthier peers. When we zoom in on kids with asthma, what we know to be true is that there's a relationship between asthma and stress. And about 15 to 30% of youth with asthma have mentioned that stress and emotions can trigger asthma episodes. And this relationship can sometimes be bidirectional, as the experience of shortness of breath can trigger worries about death or worries about disability, which can then lead to increased anxiety and stress. And research has shown that psychological distress is associated with poorly controlled asthma and poor adherence. Now, while I know that, we're here to represent Groundwork Ohio, and Groundwork Ohio focuses on our youngest children. So as such, while some of the work I'm going to be talking about today is focused on school age and adolescent youth, it's so important to conceptualize asthma management in our youngest children from this framework, a framework of prevention at these earlier ages and stages. In speaking a little bit about stress, we know that stress impacts all individuals, and social determinants of health contribute to various stressors that disproportionately affect our lower income families. And evidence has shown that the following stressors have been linked to families with asthma. So family conflict, violence, lower quality home environments, dangerous neighborhoods, polluted air and water, and then accordingly, housing related stress, community stressors, so high crime rates, poverty, chronic family stress, exposure to tobacco smoke and pollutants are all associated with increased asthma symptoms. So when we have this exposure to chronic stress, one pathway to explain this relationship is that chronic stress might be associated with a heightened inflammatory profile that then is associated with increased asthma symptoms. In addition to individual levels of stress and societal levels of stress as they impact asthma, we also have to consider something called quality of life. And a lot of research has shown that there's been this association between asthma and quality of life. So quality of life is how well the patient is adapting to their illness across all areas of functioning. And asthma severity has been related to child quality of life, where more severe asthma has been linked to worse quality of life. And there's lots of different ways we can think about this. So maybe our youth are recognizing that they might not be able to participate during recess. They might be worried about experiencing an asthma attack in different settings. Maybe they can't go to school, they miss school, or they're not able to complete schoolwork because of asthma symptoms. So lots of different areas of life that have been impacted by their asthma. Additionally, different research studies have shown a link between youth with asthma and behavior. So children with asthma demonstrate increased internalizing behavior problems. So internalizing behavior means anxiety and affective disorders. When compared to their healthy peers, they've also demonstrated increased externalizing behavior problems. So those are the behaviors that we see that are more visible to us. So oppositional behavior or attention-related concerns. And the association between asthma and behavior concerns has been shown to significantly increase with asthma severity. And then finally, we can look to the research to see a link between asthma and mental health diagnoses. So data from several community level studies have shown a consistent link between asthma and anxiety and asthma and depression amongst youth. And the youth that have asthma plus asthma anxiety or asthma plus depression are more likely to report increased asthma symptoms and burden. And on the flip side, youth with well-controlled asthma tend to have less mental health concerns. Those with asthma might develop a perception that their illness controls them, is dictating their lives and what they can do and can't do, and that it's such a challenge, which then can sometimes lead to anxiety and depression symptoms. It's also important to look to the research that highlights how anxiety and depression are linked to asthma management. So studies have shown that both anxiety and depression have been linked to not only increased severity of their asthma symptoms, but increased health service use. So more visits to the emergency room. Anxiety and depression have also been linked to more functional impairment, so impacting their day-to-day functioning, and then linked to poorer asthma control. Given that Groundwork Ohio works with our youngest kids, we have to zoom in on caregiver mental health because asthma also affects our caregivers. And that studies have shown increased rates of depression and anxiety in caregivers of youth with asthma. And this can affect asthma management. So studies have highlighted that parental stress can be related to poor medication adherence, and maternal depression symptoms are associated with asthma management difficulties. So specifically, more problems using inhalers properly, poorer medication adherence, greater exposure to tobacco smoke, and lower confidence in their ability to manage their child's asthma. So how can psychology help kids with asthma? What do I do on my day-to-day? So we're involved in lots and lots of ways. We talked a little bit about health literacy. So one role of psychology is to provide educational resources and spend time in increasing health literacy and increasing health knowledge. We also help facilitate behavior change. We're kind of the behavior experts. So how do we work together with families on making asthma management a little bit more seamless? We might consult with our healthcare providers. Dr. Ulrich and I actually work closely together to work as a collaborative team. And then we also provide psychological intervention to address those comorbid anxiety, depression, and behavior concerns. And there have been studies that have shown that when asthma education programs include psychological interventions, all of these things listed here have shown improvement. And so there is very noticeable benefits to including psychological intervention. But what we know to be true is that it's hard to access psychology services. And so studies have been looking more and more about home-based interventions, emergency room-based interventions, and school-based interventions. How can we merge my work into those settings so it's more accessible? So in other words, psychology interventions are just one piece of the puzzle when it comes to asthma management. So I'm going to kind of just very briefly touch on what I do. You may have heard of cognitive behavioral therapy. It's how our thoughts, feelings, and behaviors are connected. And we talk about how we can change our thoughts or change one of these things to affect the other. So this is a big part of my job. I also educate families and kids about our stress response and how noticing our body and when we feel stressed and the changes in our body might impact asthma and how we can be more in control of our bodies. We talk about relaxation strategies, how our mind and body are connected. Now, you might not be a psychologist. You might wonder, how can I help? We know that mental health in kids has been a declaration as an emergency across the nation. And so everybody is essential in helping. You can refer within your institution. You can look at Psychology Today, or you can encourage families to talk to their pediatricians. This is just a very brief list of apps that help with that mind-body connection. And then I'm going to provide QR codes that we can put in the chat for Kids Mental Health Foundation that has some great free resources. And then the National Institute of Mental Health also has some great handouts. So thank you for your time. And also feel free, I'm happy to answer any questions about anything I talked about today.
Thank you so much, Dr. Hunt. And we do have two questions in the chat. One is quicker. I'll start with the first one. Is Dr. Amy taking new clients right now?
Yeah, so I do have a little bit of a wait list, but you know, for youth with asthma, those are the kids that I see for therapy. And so if you're part of Nationwide Children's, you know, you can, or even if you're not, you can like just call our intake and say it's for a youth with asthma, and they would know to get put on my wait list. It might be a little bit of a list, but yeah.
Thank you. And the second is, do you find that actions taken at school or preschool, but nothing at home to be impactful? So I guess around having interventions in the learning environment, but perhaps not in home.
Yeah, that's a great question. I mean, in an ideal world, we would see consistency across settings that just helps with predictability and structure and expectations for all of our kids. But in actuality, that's really hard to execute. And so, you know, it can be really impactful if there are great interventions happening at school, but then home is a little less predictable or structured. So certainly that can cause some stress. Though I don't think that necessarily would derail anything either. I think interventions at school can be are still impactful, even if home isn't, for whatever reason, if home isn't a setting where we can be perfect with things. So I think there's it's good enough, and even better if we can have consistency across settings.
Wonderful. Thank you so much for taking the time to answer that. And thank you for bringing this perspective to this conversation. It was one that I was really excited to see included and from our work trying to improve outcomes for young children holistically. I think this is a really important component of managing chronic disease. So we really appreciate you taking the time to share your work with us today, Dr. Hahn.
Yeah, thank you.
Thank you. And I will pivot to our final speaker, Ashley Stavely. Ashley is the manager of social determinants of health at Dayton Children's Hospital, serving the Center for Health Equity to address what she calls the essence of health, standing for economic stability, social context, environment, and neighborhood, community, and education. With over 10 years of experience in serving urban, rural, and suburban communities, Ashley's passion is to create sustainable improvements in the health of communities. Through grant and project management, she daily facilitates hospital and community stakeholders through health assessments, program implementation, grant acquisition, and maintenance to address various health disparities. Ashley, thank you so much for joining us today. We're thrilled to learn more about the work that you do in Dayton.
Thank you so much. And I will definitely be mindful of everyone's time. But hopefully you can hang on with me so that I can make sure that I get to share this and represent this work very well. I also want to start out by thanking the different presenters who have gone before me so far in this presentation as panelists, because I feel like you've laid a really good foundation of the data and all the work, and just to emphasize how multifaceted this work is and how we, I feel, should be very grateful of all the great minds that we have here in Ohio focused on serving our children. So addressing asthma disparities here at Dayton Children's, we start out by looking at the data that we have obtained from the Ohio Department of Health. And you will notice from this slide that the top line for Black children it represents Black children in Montgomery County. And in 2021, the rates of asthma emergency department visits and hospitalizations was almost 6 times higher for Black children in Montgomery County than white children. But not only does this depict the fact that there is a disparity by race, there's also a disparity that exists because of the geography. So as was noted before, I believe by Dr. Ulrich, the impact of where people are at, the impacts of the environment, as our EPA representative talked about, really have had an impact on the geography of this disparity. So to dig in a little bit deeper here in Dayton specifically, we take a look at the Child Opportunity Index, which is on the left side of the slide. The Opportunity Index really goes into looking at those social determinants of health that everyone has outlined, and creates a graph based on national data on what very low opportunity is, which is the light blue, all the way up to very high opportunity. And so you will notice around the perimeter of Dayton proper is where there's lower opportunity. Those are things like the impact of maybe lack of quality of education, access to healthy foods, transportation, economic opportunity. And with this tool, I was able to also overlay the racial ethnicities of individuals within the county. And you will see that on the left-hand side of the map, in about the northwest West Dayton, there's a higher density of Black population than in other areas, once again impacted by some of the systemic racism and policies that have been in place that led to redlining, which in most major cities caused Black communities to be along highways and interstates in the outer parts of communities. Looking on the right-hand side of this presentation, you can see our emergency department visit data, and the darker red area means that there are higher numbers of emergency department visits. And specifically in this map, you will notice that's also in West Dayton. So you can see where you can draw that comparison and conclusion that the disparity exists by geography, but also with our Black population. With this data, our hospital has been working since about 2015 on implementing a community health worker program. It started with a partnership with a local university to have a community health worker in our pulmonology clinic, and grew from there. With a community health worker, we're able to really address some of those systemic issues and those disparities that exist by developing the needed relationships, the trusting relationships with families and communities that can help to really break down the walls that have been created over time with a distrust in the medical system. It also helps to provide those needed resources along the lines of education and empowerment around asthma management by reinforcing education, doing screenings for social needs, getting into the home and doing environmental assessment, and also creating a baseline and goal state around measuring asthma control with an asthma control test. For this program specifically, we currently have a community health worker in our Dayton Children's Pediatric Clinic and also our pulmonology clinic, and they are referred based on one of the criteria on the top left of this guide. This guide was created to educate our clinical staff as well as our families about what they can expect in a process when they do engage in this voluntary program with a community health worker. You'll notice that the qualifier for referral includes emergency department visits, 2 or more in the last year, or hospitalizations, urgent care. We're looking at that repeated return for visits. It could be a low asthma control test. So under 19, it's considered that asthma is not being managed. And so that's an opportunity. Environmental triggers may come up in conversations. And then also, as was mentioned previously, non-compliant with medications, which can happen because of a lack of understanding. It can happen because of a frustration in managing a chronic condition. And I want to point out that through this process, the several screenings that occur include things such as a quality of life assessment for both the caregiver and the patient, so that we can check up on what needed resources there are for the family and the caregivers. There's also an assessment of the environment, as I mentioned before. So we do have community health workers who engage with community members who can intervene with some of the things that we know are triggering the asthma in the home. And then finally, another assessment that I want to highlight is the assessment of social needs. So as we mentioned, the social determinants of health, all those different factors that have been explained in different examples are what we screen for with these patients. And the majority of our pediatric patients in our clinics here at Dayton Children's and our children's hospitals, across the state do that as well. But our community health workers are able to come alongside families to help them navigate and address those social needs so that staying on track with managing asthma becomes a little bit easier. So far, the data that we have seen, we recently were able to get to a place where we were able to pool the specific patient numbers, and we came up with a metric from the American Thoracic Society that calls for an improvement of 3 or more points to show improvement in asthma control based on the asthma control test score. And so looking at our patients at least 4 weeks apart, we had a sample size of 76 and 63% showed this improvement. And as we continue to collect data, this helps to reinforce the importance and provide the continued buy-in for the program. We also set out to collect some preliminary data related to looking at specific zip codes that I showed you in the initial map. So there are 3 zip codes that fall into that west side. And community health workers at this time, between 21 and 22, had 98 total patients within these 3 clinics that interacted with these zip codes, but only 6% were in the identified zip codes, if that makes sense. So all of the clinics, there were 98 total patients, but only 6% from the identified zip codes. We then moved to develop a key driver diagram, which you'll have this information and can review this. But based on that 6%, our aim was to move to 10% engagement. And what we found was we really needed to go back to standardizing the process to identify the eligible patients based on the asthma control test criteria. This has led to us being able to have some more robust data and find that with 117 patients engaged in all zip codes across these clinics, we now have 40% that are in the identified zip codes engaged with community health workers. But the major change in our data collection from that previous 6% to this 40% was actually being able to take into account the individuals that declined a community health worker. And we are now collecting data to identify why they are declining And this goes back to kind of the overall discussion that when a disparity exists, there's most likely an equity issue in the process. And when you define the equity issue, something like why are people maybe being referred or not referred? Is there a way we can automate the referral? Is there a reason why people are declining? And going back to some of the historical issues, I think we have to continue to build the trusting relationships with families and share the message that this is an opportunity for them to grow their knowledge and manage asthma for their children. So through this program, I believe we're doing that, but we're going to have to revisit our key driver diagram in order to look more closely at how we're measuring the success of this programming. So that was a lot of information, kind of quick, but I really want the key takeaway is that we have a huge disparity within Montgomery County between our Black children and white children. And because of that disparity, we need to support community health worker involvement with asthma patients in order to help them manage their asthma and show that by an improved asthma control test score. And then finally, we are committed to continue to work on addressing this disparity and increase the equity that we see in how we manage care and how we deliver care to patients. Thank you guys for having me. And here is my contact information. Definitely always happy to discuss the topic, and am thankful that I had the opportunity to be here today.
Thank you so much, Ashley. And feel free to leave your slide up too so that folks can jot down your contact info. I have one question. I know we're running short on time, but I did want to share. We have a question around whether the issue might be more around poverty than race. And this came on earlier in your presentation. And I think some of the slides that you shared afterwards about the prevalence among Black children versus white show that there is a very clear disparity that's race-based. But there's a follow-up question that is around whether the solution might be more hopeful with some action and precise implementation. I don't know if you wanted to answer that from a community health work perspective, Ashley. It'd be great to hear if there, I think you've touched on it a bit in your key takeaways, but a little bit more about some precise action that could happen to mitigate the disparities.
Yeah, so I would say two things that I forgot to mention that are pretty important. So in 2021, we opened up a clinical site in Northwest Dayton. And so actually being within that community is one of the reasons why this data is so new, is because it's also, you create access to care, but there's still that barrier. Do people want to access that care? Do they trust you enough to access that care? And so that is going to take time. It's not just that if we build it, they will come. But we are a part of a partnership with Sinclair Community College. There's childcare there. So it's a multi-component center, and the clinic is a part of that. So we're continuing to build that relationship. So that is one of the more targeted approaches and opportunities that we have. The other is that in the spring of 25, we will actually have a urgent care that will be placed in West Dayton, another partnership with a community organization that will have a WIC-focused grocery store. And so that's another place where we are hopeful to continue to build those relationships. And the urgent care is that stopping point, right? But it's another connection to care that's right in the community.
That's incredible. What an exciting update. I feel like we got some hot off the press news from Dayton. So thank you for sharing that, Ashley. And just a final thank you to all of our panelists. I think they've all included contact information in their slides, and we're happy to send out our follow-up information. One more plug for our Momentum Institute in September. We'll be having another monthly webinar series in August that will be featuring some speakers to speak about young children and young families and housing insecurity and homelessness. So we'll send out more information about that soon, but really appreciate the time everyone shared with us today. And to just be able to take over this topic and look at it from the perspective of children's health, mental health, community health, environmental health, and that statewide data. So thank you again to all of our speakers. And please feel free to reach out. I see some of them are putting their information in the chat. And if you have any follow-up questions that aren't captured in the data we send out following the webinar, feel free to email us at info@groundworkohio.org. Thanks so much, everyone. Have a great afternoon.